Q-Care RX cleansing and suctioning systems contain 0.12% chlorhexidine gluconate oral rinse in convenient single-dose bottles. Each Q-Care RX system is packaged in different configurations to match your protocol, and they're designed to eliminate confusion about which component to use next. The success of your oral hygiene program relies on following your facility's protocol and complete utilization of the kit within a 24-hour period. Dental plaque biofilms are a known risk factor for respiratory infection. These infections can result in significant human and financial costs. Comprehensive oral care will help you address dental plaque and secretions in the mouth. To start, you'll need a suction canister and tubing for a dedicated oral suction line. Open the bag by tearing the perforation. Remove the Q-Care system. Hang it on the bedside bracket so it's always ready for use. It can also be hung on the bed rail with the hang strap. Use the Y connector if an additional suction port is needed. Both ports of the Y connector must be used or a loss of suction strength will occur. Next, detach the covered Yankauer from the top of the Q-Care system and connect it to the suction tubing. The Yankauer should also remain attached to the suction line, except when the suction toothbrush, swab, or catheter are in use. Always use a bite block when performing oral care on patients with altered levels of consciousness or those who cannot comprehend commands. Consult the package for complete warnings and indications. The covered Yankauer helps remove oral debris and secretions. To use it, retract the sleeve all the way down and begin suctioning. After each use, rinse with sterile saline or cleansing solution to clear the suction line. When finished, slide the suction control switch to the off position and pull the sleeve over the Yankauer tip. The covered Yankauer should remain attached to the suction line whenever it is not in use. It can be stored in the disposable Yankauer holder. Snap the covered Yankauer into the holder between uses. Remember, the Yankauer holder is for single patient use only. Dispose of the holder after your patient is discharged or moved to another room. To begin, remove the oropharyngeal suction catheter. Peel open the package and connect the catheter to the suction line. Place thumb over Thumbport to begin suctioning. The catheter has a long, flexible design, allowing for suctioning of the oropharyngeal area. It helps remove oral secretions above the vocal cords before they migrate. When finished suctioning, rinse to clear the line. Disconnect and dispose of the catheter. Reattach the covered Yankauer to the suction line. The suction toothbrush with oral rinse should be removed from the system next. Peel open the packaging. Open the bottle by pushing down and turning the lid. Pour the entire contents into the open package, allowing the oral rinse to saturate the toothbrush and applicator swab. Attach the suction toothbrush to the suction line. The soft bristles remove dental plaque on the teeth. Debris and secretions are removed when you activate the suction by placing your thumb over the suction port. When finished suctioning, remove your thumb from the suction port. Rinse to clear the line. Disconnect and discard the suction toothbrush. Reattach the covered Yankauer to the suction line. Next, make sure the applicator swab is saturated. Apply the rinse to the oral cavity, including the teeth. Use the covered Yankauer to suction any remaining solution. Again, when finished suctioning, rinse to clear the line. At the next cleaning, remove the suction swab from the system. Before opening, burst the solution packet inside the package with your thumbs. Allow the oral cleansing solution to saturate the suction swab. The suction swab has perpendicular ridges, which allow for better cleaning between teeth and stimulation of the oral cavity. They are also treated with sodium bicarbonate to mechanically clean and refresh. Peel open the package and set the mouth moisturizer and applicator swab aside. Remove the suction swab and attach it to the suction line. Swab the oral cavity for approximately 1 minute. When finished, place thumb over Thumbport and begin suctioning. When finished suctioning, rinse to clear the line. Dispose of the suction swab and reattach the covered Yankauer. Next, apply the mouth moisturizer liberally to the lips and the inside of the mouth with the applicator swab. Repeat these steps at your next scheduled cleaning, according to your protocol. Remember, protocol compliance is essential to ensure the success of your oral hygiene program. You can achieve the oral care outcomes you desire with comprehensive oral care. Sage Products is at your service with innovative products and in-service support. The yank hour should also remain attached to the suction line, except when the suction toothbrush, swab, or catheter are in use.